Today I'm joined by Dr. Saba Maroof, a child psychiatrist who will discuss the myths and misconceptions about working with a psychiatrist, address the stigma related to mental illness, as well as how to treat OCD. In this part one of 2 episodes, Dr. Maroof talks about whether medication is necessary in every case and what needs to occur prior to taking medication. This interview was filmed at the start of the 2020 pandemic and was originally part of the week-long mental health summit that I organized in May 2020. If you're not familiar with me, I'm just going to quickly introduce myself. My name is Nafisa Sekandari. I'm a licensed clinical psychologist specializing in anxiety-based disorders. I have a private practice in Arizona, and I also manage the Transform Anxiety private Facebook group, as well as the mentalhealthformuslims.com website and Facebook page. I also have online courses to help people transform their anxiety at their own pace and from the comfort of their own home. You can find me on social media, on Instagram at Dr. Nafisa Sekandari, on Facebook at Dr. Sekandari, and YouTube and LinkedIn. So please join my private Facebook group, the Transform Anxiety, and join the conversation on mental health and help you share information with each other. So I'm trying to build a community where we can all support each other. So I'm going to introduce Dr. Maroof. Dr. Maroof is a board-certified adolescent, and adult psychiatrist from Michigan. She obtained her undergraduate degree from the University of North Carolina at Chapel Hill and her medical degree from Wayne State University. She went on to complete her residency at Henry Ford Hospital in Detroit and further pursued a fellowship in child and adolescent psychiatry at Wayne State University. She has spent the past 8 years working at multiple outpatient clinics in the greater Detroit area, where she sees patients of all ages and backgrounds. Dr. Maroof started at Huda Clinic, a local free clinic in Detroit for psychiatric services. She's passionate about community education through teaching residents, fellows, and students, as well as collaborating with community and religious leaders in an effort to break barriers of stigma. Welcome, Dr. Maroof. Let me add you to the stream. Welcome. Thank you for joining us.
Thank you so much for inviting me, and thank you so much for having this amazing event. I mean, just days of learning and education. It's really amazing, especially right now. We really need this. Like, the mental health needs are just going to be, increasing. We know the mental health impact of quarantining and the coronavirus and the quarantining, the social distancing are going to be really great. So I really appreciate it.
Well, thank you. Thank you for making the time. So I shared a little bit about your bio and your experience, but tell me a little bit about your background and the work that you do, and what got you interested in psychiatry and mental health. And is there a personal history of mental illness or mental health or stress management in your own family? So if you can share a little bit about that.
Yeah, sure. Well, actually, I guess that kind of takes me way back because I'm the daughter of immigrants. My parents came from India and Pakistan, and my mom actually, she is a physician from India. And when she first came, my parents settled in North Carolina, and she did a whole residency in radiation oncology. And then she realized that it wasn't really her passion, and the part that she loved was connecting with patients and spending time with them and talking to them. So she actually totally switched gears and started her training in psychiatry. And we actually moved overseas for a little bit. And so her training was kind of interrupted. And then when we moved back to the States, I was in high school, and to get back into psychiatry, she actually had to do a fellowship. The only way she could do it at the time was to do a fellowship in child psychiatry first, and then complete her general psychiatry residency. So that was really a huge impact. It had a huge impact on me because I was in high school when she was completing her residency. And so I really, I remember all the stories that she would come home with and just the passion that she had, and she still has. She's a practicing psychiatrist in North Carolina, and she has her own practice there. And I just remember she was always studying and always reading, and there would be books surrounding, just kind of all across our table. The Boy Who Couldn't Stop Washing, and all these textbooks with like the pictures of all the attachment studies with the monkeys and the white, you're familiar with those studies. And I just found it really fascinating. And basically from a young age, I was very interested in kind of human behavior and relationships and how the mind works. So I think that really kind of made a big impact on me. And so I actually decided to go to medical school, but and this was kind of unusual. I knew what I wanted to do before I started. Many people decide while they're in medical school, and I did keep an open mind. I did explore other options, and I really enjoyed all my rotations. And so I actually decided to go to medical school, but I really loved it. And the interesting thing is, and I was going to talk a little bit about the shortage of psychiatrists that we have in this country, especially child psychiatrists. There's a huge shortage. But there's not really a lot of encouragement. At least there wasn't at the time. It might be changing now. There wasn't a lot of encouragement to medical students, for medical students to pursue psychiatry. My class was unusual in that we had more students apply and match into psychiatry than pediatrics, which was very unusual. But really, there's, and I was going to touch, of course, we'll probably touch on the stigma, but there's actually kind of a stigma even within the medical community. I mean, I had physicians that I was working with, like, for example, in the emergency room, I remember really specifically one doctor was like, "Oh, wow, you're so smart. Why are you going into psychiatry?" So this really, I think it's getting a little bit better, but there is this idea that it's not real medicine, or we're not real doctors, and that they just kind of different misconceptions even within the medical community. So that's okay though. I mean, I really love what I do, and I love connecting with people and kind of helping them in their journey. So that's just a little bit about it.
Wow. I mean, I was going to talk about the stigma within the Muslim community, because we were talking about that yesterday, how even I was discouraged about going into the mental health field by my family. And then here you are, your mom was a psychiatrist, and then you're into it. That's amazing. And then it's sad and unfortunate that the medical community looks down on mental health or going into that profession. But I'm so glad you did it. And especially, like you said, child psychiatrists, we definitely need more of those. Mm-hmm. And so, so you're kind of atypical in that you didn't grow up with that stigma in your own family because your mom was in that field, right?
Yeah, I mean, there was definitely that encouragement, but still, I did have comments from family friends, that sometimes same kind of thing. They were kind of like, "Really, you want to go into that field?" So, yeah. But it's funny because, and I'm sure you've experienced this too. You've probably had those kind of comments, but then everybody has mental health issues that come up at some point. So I think everybody is kind of touched with either with someone they love, or a loved one, a friend, or if they're going through a rough time themselves. So.
My sister's a dentist, and at family gatherings, nobody talks to me about mental illness. They all go to her. They can talk about the teeth, really? There's no problem, but nobody will come and talk to me about. So yeah, I mean, I think there is that issue still, and yeah, everybody does have a mental. We have a brain, we have a mind. It's good that we're going to have issues, but there is that stigma that nobody wants to talk about it, and there's a lot of shame. So it's unfortunate. So I wanted to ask you about, given that there's stigma, given that there's a lot of reasons people avoid even addressing mental health issues, what's your belief about people putting off mental health treatment, and what are the consequences and ramifications for people not getting treatment due to the negative attitude or the stigma? Because a lot of people are like, "Oh, I'll just forget about it. It'll go away," or "I'll just suffer through it, and it'll just go away," basically. So can you talk a little bit about that?
Yeah, definitely, for sure. I would say that, every situation's a bit different. It really, of course, depends on kind of the issues that are, that person is facing. Actually, it's interesting. What I see a lot of, I see quite a few young adults, and definitely adolescents, teenagers. And it's very fascinating to me that the kids themselves, the teenagers or the young adults, are very, they're ready to, they're ready to initiate their own treatment, that they know that they need help. But oftentimes the parents are actually a little bit more hesitant or flat out discouraging treatment. It takes a lot sometimes to convince them that, even just for therapy, and then much less, if we're talking and I feel like medication might be an option. There's just even within families, it's very fascinating. But definitely, it's kind of like with all fields of medicine and with any kind of issue that you have, pushing it off is not necessarily going to make it go away, right? I mean, you don't treat your blood pressure, you might not, and that's why high blood pressure is so dangerous, that you might not have active symptoms, but it's affecting your body in ways that you cannot see all the time or you can't feel. Same thing, with diabetes, we could be in denial and just say, well, I don't have a problem, but there's something going on in your body. And it's kind of the same thing. There definitely are times where you might go through a difficult period, and it might, because of the situation that you're in, it could resolve on its own. But then there's other times that it is festering. And the longer that you put it off, we really do believe that it actually can get harder to treat as well. There's definitely certain types of mental illnesses that it is harder to treat the longer it goes on, especially when you're talking about anything to do with psychosis. And then also, if you start medication and then stop too early, or if you keep starting and stopping, we actually think, we do know that for some conditions, that same medication might not work again, for example, if that helped for that time. So, there's a lot of things that go into it. It doesn't mean that you have to be in active treatment forever, but definitely as soon as you can. But, the other thing, though, is that, when we do know from surveys and studies that when people are going through difficult times, they're not necessarily going to reach out to a mental health professional initially, and that's okay. Who are the people that they're going to reach out to? Are family, friends, and then actually maybe they're oftentimes in the Muslim community, their local, their imam or their religious leader. So actually mental health professionals, they might be, there's a very small percentage of people that they're going to reach out to somebody like that very early on. But, that's why it's kind of important, even as a friend, if you feel like that some of the problems are kind of serious and too serious for you to address, and you think somebody needs professional help, even just your encouragement could make a huge difference. Sometimes with depression and very, higher levels of depression, where we kind of justify a lot of things. We have, like, our logic might actually even be a little bit off. So having somebody give you good advice to that, I think this is a little bit more than expected. Your response to this kind of situation is a little bit more, maybe you need some professional help, that could really go a long way. So usually, we all want to go to somebody that we trust, and that's okay. But if the problem has been going on for long enough and it's really affecting your day to day, you feel like it's affecting, just the way, like your work, your ability to study, your ability to go to school, your relationships, then that's probably when you want to talk to somebody.
That came up, that issue of going to somebody you trust, yesterday, both in the Latin community and the African American communities, as well as the Muslim community, that people want to go to somebody that they know and somebody that's already vetted by somebody else, right? Yeah. And then also another question that came up yesterday was, how do you help somebody that has depression and anxiety but doesn't want help? So I just wanted you to address that if you can really quickly.
That's kind of a tough one. I think that as much as you can, being supportive, but sometimes just that's a hard one, to be honest, because you also kind of have to pay attention to how that's affecting you. And sometimes if we are giving of ourselves too much beyond our capacity, that can have an effect on us as well. And, again, it depends kind of on the situation. It really is kind of a case-by-case basis. But if it's, I'm kind of thinking more extreme things, like if you have a friend that's, struggling with thoughts of hurting themselves or something like that, then that can be really serious. It depends on your age. If you were like a teenager and you have a friend that's struggling, then at that point, if it's to that extent, that at that point you might need to bring in like a trusted adult and let them know this is kind of what's going on. And that could be really hard. That's a really difficult situation to be in. But, you know, you just kind of have to know that you're doing this for their own good, that you're doing this to keep them safe. And I know I kind of went to the most extreme probably example, but, you know, that can be really hard. Sometimes there's things, I guess it's kind of like knowing what your limitations are. And that's kind of why we talk a lot about boundaries in our profession, but it kind of is true for, you know, whether you're in treatment or not. It's an important concept that you're going to have a limit of how much you can help somebody. And there are people, if they don't want the help, then, you know, kind of understanding what your limit is, realizing what your limit is, and there's only so much that you can do. There is a point where a person's going to have to kind of decide for themselves if they need help. And you can be that supportive friend, you can be there for them. But I've definitely heard of situations and had situations where a friend will be like, I'm really sorry. I'm here for you. I'm always here for you, but there's only so much that I can do. And I really believe that you need help. So I guess kind of like continue to encourage them, help them maybe find resources or help them talk to somebody that knows more than you. But kind of knowing those limitations and being okay with that.
I mean, even as a therapist, I know I can't help anybody that doesn't want help. There's only so much I can do. I can only, like, even as a friend, if you know somebody, you're only responsible for your own reaction. You're only responsible for how you're dealing with them and not personalizing what they're saying and doing. Like you said, offer them support, offer them resources, offer them information, and then it's up to them ultimately if they want to get help or not. And it is a frustrating place to be. Like you said, it is a hard thing to deal with.
Mm-hmm. Well, that's very true. Even as professionals, you're right. I mean, we're in this position a lot as a therapist, as psychiatrists. And sometimes, but you know what? It's also not to be taken in vain. Even for me, there's times a person is actually coming in to see me, but they might, you know, and for you too, they were seeing their psychologist or seeing their therapist, but they're not always following, I guess, the suggestions or the recommendations. But I feel like, you know, they're still always listening, and it still makes a difference.
Hopefully, yeah. And then really quickly before I forget this one, somebody asked on Instagram a couple of days ago, how to stop catastrophic thoughts and then being more optimistic. Any suggestions you have for catastrophizing and being more optimistic before we move on into other deeper topics?
That's a really good question, especially again for right now. You know, with everything that's going on, I'm sure a lot of us, even the ones, you know, we feel like we have some good coping skills. I think all of us are catastrophizing to a certain extent. I know myself, I have to catch myself, especially if I'm thinking like beyond the next few weeks. It can be really easy to just kind of let your mind start going, and, you know, especially with this situation. So I think one thing is like acknowledging, and I'm sure you would agree with this, all therapists, I think we're talking a lot about this issue right now, acknowledging what you're feeling. Sometimes when you try to push something away, or you try to kind of push a feeling even like under the rug, or just try to push it away, it's like it kind of comes back even stronger. So acknowledge that you're feeling this way, acknowledge your thoughts, you know, put a word to those feelings. That can help a lot. And then also kind of make a connection to what might trigger those thoughts. If you get triggered, especially by watching the news or reading, I mean, especially for scrolling through your social media, especially before bedtime. Here comes one of my kids. Then realize that that's a trigger for you. So maybe it's not a good idea to be, you know, we all have to kind of limit our social media, especially the news and any kind of negative articles and things like that. It's just not helpful. Like, is it helpful for me to know what's going to happen a year from now? Nobody really knows. And that's just kind of causing me more stress. So focusing on what you can control right now, what you have control over, whether that's just, you know, just kind of maintaining your own schedule in your own household, whether that's, okay, I'm going to make sure that I get dressed every day, and I'm going to be out of my pajamas, make sure that I'm going to get outside and get some exercise every day. So kind of like those things. And acknowledging, you know, again, not suppressing those feelings or emotions, kind of acknowledging that they're there. leaning into them is kind of what many therapists say. Also, a lot of people are talking about, and you're going to have someone talking about this too, but the role of meditation and deep breathing can be huge. Really, the act of deep breathing can kind of, it almost tricks your brain into kind of slowing down as well. What happens is that our thoughts are going so fast, and we kind of do go into that fight or flight response, and deep breathing kind of slows that down. But if you really feel like it's getting to a problem, then, reaching out and talking to somebody, talking about it, talking to coworkers or to your friends, and chances are, when you can talk to others and realize that other people are kind of feeling this way too, then that kind of helps as well. Doing something that helps somebody else, so community service, or help, not even like a formal act of community service, but just helping somebody, taking some food to a neighbor, or it just right now, especially if you're working from home, just being outside and talking to somebody, maybe taking a walk with social distancing with a friend. So you're kind of doing something, you're doing something active, so that you're not just focused on your thoughts in that moment.
No, those are really good tips, because when you're catastrophizing, you're future pacing, you're focusing too much on the future, and we have no control over the future. We don't know what's going to happen. There's a lot of things that could happen. Yesterday, I talked about life quakes and how things can happen and they can shake us up. But if we prepare for it, if we're constantly focusing on prioritizing our mental health and staying mentally and emotionally healthy and stable, doing the breathing exercises, calming our fight or flight response, that can help us not freak out and go into that future. And then, like you said, grounding and focusing on this moment, because really this is all we have control over. Exactly. And focusing on what it is that you do have control over, which is our breath, our thoughts, challenge the negative thoughts. Don't believe every thought that you have. That was a huge one for me.
Yes.
Don't believe every thought you have.
Our thoughts
can lie to you.
Exactly. Our thoughts are not truth.
Right. They can lie to you. And I tell this to my patients all the time. The biggest revelation for me was seeing a bumper sticker that said, not every thought you have is true. And I was like, really? Because I was believing everything that I was thinking.
Exactly. That's very liberating.
It is. So just that, I like that, killing the ants, the automatic negative thoughts, challenging them. Is this thought 100% true? Because sometimes our brain will exaggerate a thought and make it something that has a 5% chance of happening into like 100% chance that it's going to happen.
Exactly.
So yeah.
All like cognitive techniques that, that therapists use every day. And by the way, psychiatrists too. I think another misconception is that, and I see this even with my own patients, like they'll start talking and they'll be like, oh, well, I'll just talk to my therapist about that. I'm like, no, it's okay. You can talk to me. Like, we do have some time you can talk. It might not be an hour long, follow-up appointment, but I want to hear what's going on. And oftentimes people feel like it's very categorical, like, okay, I'm just going to talk about medications with you. I literally have some patients, sometimes they have a medical background. They're like, yeah, I think I think my serotonin's a little low, or my dope. And I'm like, no, just tell me how you're feeling. I don't.
That was going to be my next question, because there is that stereotype that psychiatrists only deal with medication. Do you want to talk a little bit about, do you always prescribe medication? And then also, are there steps that should be considered prior to taking medication?
Yes, those are really great questions. So no, I don't always prescribe medication. And, of course, by the time somebody is coming to see me, that is definitely something that's on the table. But to be honest, especially people that, might be from the community and maybe it's a personal recommendation, sometimes people just want another opinion. They want another set of eyes on kind of what's going on. And that's okay too. And, our training is really comprises of, yes, we do rotations in the psychiatric hospital. We see the most severe patients. Obviously, those patients, pretty much everybody that goes into the hospital is usually going to leave with some kind of medication or some modification of what the medication is that they're on. But those are kind of the very severe cases that, like I said, psychosis, or after a suicide attempt or something like that, or dealing with chronic suicidal thoughts. But no, I mean, there's many times where somebody will come in and we don't start medication, and actually sometimes they might be a little bit disappointed, but I really try to stick to that it's really important that you you really try to give therapy like a really good chance, meaning, not just once or twice, but a few weeks, a few months. Even for kids, many times we like try to do therapy for like a good 2 or 3 months, even 6 months before we decide, if medication is going to help. But at the same time, knowing that there's no magic pill. Medication can help tremendously, but we still all, we really recommend that everybody kind of do their part in like trying to make sure that they're getting enough sleep or on maintaining some type of schedule, looking at diet. And then again, just what we were talking about with the cognitive therapy, cognitive behavioral therapy, examining our thoughts and our feelings and, especially kind of interpersonal things, the dynamics that we have with certain people that kind of might trigger a lot of emotions with our family members or a significant other or friends. Those are really all important things that there's so many things that contribute to presentation, to how somebody's feeling. So many layers of what make all of us who we are, the day to day and all those emotions that kind of come with all those interactions. So it's really important as a psychiatrist, I'm interested in all those things too. There's times even when I will say, I'm not saying that you necessarily have to be on medication, but in this situation, it could help. So we could try something now, or if you would like to just stick with therapy for a few weeks or a few months and then come back. And that's a good situation to be in too. You also don't want to be in a situation where you are scrambling to find somebody to help you. It kind of is like, for many years, yes, I'm a physician, but for many years I did not go to my doctor. And my mom would like just get upset with me because then I'd find myself like in the winter, every year, once a year I'd get sick or something. And she's like, why don't you have a primary care physician? This is why you need a doctor. When you're sick, then you can easily get in with somebody. Because then when you're trying to find someone to go to, when you're like, you really need, when you're kind of like in an urgent situation, it's very difficult. So even in that case, I think it's nice. I do definitely have patients that, we've decided together, like, what, I think you're doing okay. Maybe you don't need medication anymore, but they still come in and check in and see me like every 2 months or so, just to kind of see how things are going. So it's kind of like a safety net. So they know that if in case things do get, if they start to feel their symptoms again, or there's something going on in their life that they're not sure how to deal with. And that's also while they're in therapy, but they're still coming in regularly to kind of check in with me, if that makes sense.
I'm so glad that you as a psychiatrist are talking about all those things, sleep, diet, and that there is no magic pill. If there was, we wouldn't have such an epidemic of mental illness right now. If a pill could erase depression and anxiety, then everybody would be on a pill and we'd be happy, right? There has to be more work done. And I'm glad that you brought that up. And then also a lot of people are afraid that if I go on medication, is that going to be forever? So what's the time frame of being on medication, and how do you regulate that and determine when people can get off and wean off? And then what's the process of weaning off medication?
So very good questions. And it's, of course, it's so individual and really kind of a case-by-case basis. But, really it depends on the personal history and the individual presentation. It depends on kind of, that's why it's really important to kind of have a diagnosis. I know that many people sometimes are a little bit uncomfortable with the labels, and it's not that we're like labeling you, but it's important for us to kind of have an idea of like how to treat what we're treating. We don't want to necessarily just throw medications on for this symptom and then something else for it's really important to kind of have an idea of what we're dealing with. So, there are a few general rules though. For example, for depression, if there is an episode of depression that a person is experiencing and it gets to the point where they do need medication, if they've just had one episode, then definitely we never tell anybody you have to be on it for the rest of your life. Now, it kind of depends on the severity too, though. But if it's something that kind of keeps recurring, and we're seeing someone with recurrent episodes, so that's what we'll say major depression, the diagnosis will be recurrent major depression, especially if it's like moderate to severe. Mild depression, we don't usually really like to treat with medication. And even sometimes I'll have patients that want to try it, and I just tell them that, we could start you on medication, but I'm not sure you're really going to notice that much of a difference. And that oftentimes happens. They're like, I don't really notice a difference. I'm like, yeah, I think that you would be fine with sticking to therapy and kind of talking about those other things. But definitely if it's kind of more of a moderate or severe, and that means like, for example, just great difficulty getting out of bed, it's really affecting kind of your day-to-day. Like, for example, college students. I have many college students that come in and they describe this, that they go through this period where they like can't get out of bed, then they start to miss classes, then they start to get overwhelmed with all the work that they have, but they're almost paralyzed and they feel like they can't get back into it. They might end up dropping a class. They're not really taking care of themselves. They're not really focusing on what they're eating. They might be losing weight, or they might be gaining weight because they're making really poor health choices, nutritional choices, things like that. So that's where, medication would be helpful. And now if it's been one episode, no, nobody would say that you need to be on it forever. But definitely if an individual has had several episodes of depression, then yeah, you might say, we might say, it might be a good idea to kind of stick with this medication, just because, that all of that can really cause a really big disruption in a person's life. And do you really want to keep going through this where you start to experience symptoms and, some people are losing months of their life in this way. So is it better to kind of stick with the medication for a longer period of time so that you can, kind of have some stability? Now there's other diagnoses where you probably are going to have to be on medication. And again, that's really just to kind of make sure that you're kind of stable and you're not just having like these ups and downs all the time that are causing disruptions in your, with work and with your interpersonal relationships and with, even exacerbating your medical conditions, things especially like bipolar disorder. And that's why it's really important to try to get a good diagnosis, but it can take a long time to get a good diagnosis. Really, on average, it takes an individual, it can take like 10 years for an accurate diagnosis of bipolar disorder, as you probably know. In those situations, it's probably better if somebody, is on medication more long term. Again, these are kind of discussions to have with a psychiatrist individually, but that's kind of generally what most psychiatrists will say. Definitely, if you're talking about other things, such as, of course, any kind of like schizophrenia or something, yes, you do. And the more times you get off of medication, the harder it is to kind of find something that will work. Another, of course, condition is anxiety. Now, anxiety is interesting because sometimes for some people it can kind of bubble up again during times of transition. So, starting college, or when you first move out from your home, maybe your first job, basically those major life transitions, getting married, first baby, then you get into the, of course, topic of postpartum depression and things like that. It kind of depends how that person is doing, but definitely kind of being open to coming back to therapy during those times. And if you know that transitions are hard for you, then kind of knowing that about yourself and being ready to kind of have your resources there. Okay, I'm going to talk to my primary care doctor about it, or make sure that I have a therapist. If I'm moving to another city, what are the resources there? So kind of like being prepared and proactive, so that you're not, it is much harder to treat symptoms once they get to a certain extent. It's kind of better to kind of nip it in the bud, I guess, so to speak. So again, it really depends on the diagnosis. It depends on your own personal history. I don't know if that answers that question, but.
Definitely. I mean, it's obviously a case-by-case situation. Everybody's situation is different, but knowing that there are options for trying a medication or trying different ones and see what works. And if you're into weaning off of a medication and trying therapy, those are things you talk to your doctor about and work out a solution, and not just get off medications that you've been on for a long time by yourself, making sure that you're weaning off appropriately.
Yes, for sure. Yeah, I didn't touch on that, but definitely, depending on the doses, the type of medication, the doses, there's some that you can get off pretty quickly, and there's some that take a little bit of time, but definitely I would recommend doing it under the direction of your psychiatrist. And then I have people that say, oh, I missed my medication for a few days or a few weeks for whatever reason, and I'm feeling fine. And I kind of try to educate them on that too, that's good. But, sometimes our mood definitely can be cyclical as well. So just because you're doing okay a few days or even a few weeks, like you still want to really kind of monitor it. And I'd still be more comfortable if you're kind of coming in regularly and checking in and just making sure everything is okay.
Great. I know a lot of people have a struggle with OCD. I mean, it runs in my family. OCD is an anxiety-based disorder. And so I have a lot of patients that struggle with OCD and anxiety in general. So there a lot of questions have been coming on Instagram and Facebook and on email about how do you treat OCD? What are some good strategies as a psychiatrist? Best strategies or the best approaches to treating OCD?
Yeah, definitely. OCD is, definitely something that you would want to get help for. And sometimes people don't really realize it. Actually, the other thing is that we kind of tend to throw the term around a lot too. Sometimes somebody will come in and say, oh, I have OCD because I always have to do this or that. But it really does kind of have a very specific presentation. Really, anytime you have any kind of recurring, so there's two parts of it, the obsession and the compulsion. So any kind of recurring thought, and then if you feel like you cannot act on that thought, like that's the compulsion part, then there's kind of this rising sense of tension. So of course, the thing that we usually think about is cleaning. But it's not just like, being like a neat freak or having things in their right place, but oftentimes it can take a very ritualistic kind of meaning, where you have to do things a certain way, you have to do things a certain number of times, where literally you feel like you cannot leave the house or go on to the next step until you complete it. Sometimes people have these routines for their going to bed, and it can take hours. It can take hours to like kind of go through those routines, and and that's kind of the big thing, is it's taking hours to kind of go through these rituals. Another thing that it's really interesting, it can kind of even come and present in kind of a religious way. And there's a term specifically, a term for that called scrupulosity, which is kind of OCD, where you're intertwining kind of the OCD with kind of religious kind of practice. So for example, I've definitely had Muslim patients who are really concerned about cleanliness. So, for Muslims, we have this idea of being clean so that we can pray, and we pray 5 times a day, and we have like we wash ourselves 5 times a day. And if you get anything on you, then you have to go take a shower. And so I've seen people that are so concerned that even like just a little flick of something, whether they're so obsessed with having urine or something on a small speck, like after when they use the bathroom on like their clothes or something, they will go and take a shower, like shower 5 times a day. And it's very distressing. And they know that it doesn't make sense. They know that it's illogical. And oftentimes people with these compulsions know that it doesn't make sense, but it's like they kind of can't get out of that frame of mind. I mean, so this person, she was actually a physician, and she went with the OCD about cleanliness, and she totally diagnosed herself. She recognized that this was a problem, and she recognized that it was totally illogical, but she couldn't really move on. And so usually this is definitely a case where therapy, of course, is huge, really important. And as you know, usually what we recommend is like the exposure and response therapy, where the therapist will work with the individual in kind of giving them like small exposures and trying to build their tolerance to that. So, and it's kind of like in a hierarchy. You kind of start from the lowest thing. You rate the smallest to the highest thing that really kind of bothers you, or the compulsion and the obsession that really rings true for you. And then definitely medications can help a lot too. And usually they're the same type of medications that we use for depression and anxiety, the SSRIs. But there are some specific medications that we use that seem to be more helpful in OCD, which leads us to think that this does kind of affect kind of a different part of the brain, perhaps, or it's kind of a little bit of a different type of mechanism. There are some specific medications that I like, for example, that I don't really use anywhere else that I might use for OCD, and it can really help. I even have a therapist that sees a lot of kids, and she has quite a few substantial caseload with OCD with kids and adults, and she really finds that it really helps to have medication on board. It's almost hard for her to kind of get to the real work and the real treatment because they're so anxious and they have like this inability to be able to relax. And so sometimes medication can kind of, definitely in many cases, it can help you be more relaxed and kind of get to that place where you can actually use those coping skills that you would use in therapy. So that's kind of why the conjunction and the collaboration can help a lot.
I know I see OCD as a spectrum disorder, and that there are people that are on the extreme end. Like you said, it's so debilitating. They're taking showers 5 times a day. It's like, think of the movie As Good as It Gets with Jack Nicholson, where he can't really function. It really rules every aspect of his life. And then there are other people that fall somewhere on the spectrum, and that somewhere on the lower end, somewhere on the middle end. But it's like, even the cleaning, what I found is it's one thing to want a clean house. It's another thing that it has to be clean. Otherwise you can't go to sleep. It's like all your behaviors fueled by anxiety. And so when that's controlling you, it's very difficult for you. So I say, yeah, go ahead and like a clean house, but make sure you're choosing instead of allowing anxiety to control you. And then what I've also noticed is that all the lifestyle stuff you talked about, the diet, the nutrition, the lack of sleep, all of that, when that's not in place, when you're not taking care of yourself, your OCD will get significantly worse. And so for people that are actually making an effort to control all of that, making sure they're eating the right foods, making sure they're calming that overactive fight or flight in their system, they tend to manage their OCD and their anxious thoughts more. I know there are people that are asking about blasphemous thoughts and OCD and with religiosity. I'm glad you brought that up, because my article on scrupulosity and religiosity in Islam is one of the most read articles on mental health for Muslims. A lot of people request information and help about that because it can be debilitating. Just even getting ready for prayer can take hours. Even their prayers can take hours. Did you have any more to add to that?
No, I mean, well, a little bit. I mean, I guess also I think it would be really important to talk to, even maybe if it could be helpful to talk to like your local imam, especially if they're psychologically minded. And I think many of our imams are definitely, mashallah, seeing, well, first of all, they see firsthand the impact of mental health. I mean, sometimes, like I said, they're the gatekeepers. They're the people that are seeing the issues with marriage and individual issues. They're seeing it in their office first and foremost, oftentimes. And I know our local imams oftentimes reach out to the local Muslim mental health professionals quite often. But I think that could be helpful because it could help the individual. I think it's important to kind of get both aspects of it. Like, you have the psychological support and kind of the medical explanation, but even kind of the religious support too. That could be kind of part of the healing too, that, like for Muslims and really all people of faith, emphasizing that God is the most merciful, and that God does not want, there's in Christianity, of course, there's the concept of love and we're God's children, and Islam is no different, where we have like this huge emphasis on the mercy of God. I definitely have kind of seen it go other ways too. I know of a case where there was a individual who was kind of wondering, like, he loved music, and he was really worried about if this was kind of allowed. And he did go to a local, like a religious kind of leader or advisor, who kind of gave him this advice that I almost feel like it kind of instigated or triggered kind of like this obsessive thought too, that anything, if I want to play music, then I'm a bad person, and I kind of have to expiate that. So it took him a lot of time. So I think it's really important to go to a balanced person. Unfortunately, sometimes there can be that negative, where if you go to someone that might not be understanding or is giving you a ruling that's not taking, like that's kind of very black and white, that could possibly trigger a reaction like that. So I think collaborating and seeking advice from someone that is more psychologically minded would be really helpful. This is also possibly where a person might feel more comfortable going to somebody of their own faith in terms of a therapist. Like, for example, I told you about the Muslim woman that I had that was really concerned about her cleanliness. I think that many therapists are pretty, culturally competent, but it was really important in that case that I talked to the therapist and kind of explained to him about the ritual washing and things like that, so he kind of understood where that's coming from. Other types of religious OCD are like for confession, a lot of like guilt. Anytime that you have like a negative thought or a guilty thought or some kind of doubtful thought about God, feeling like you need to go for a confession. So some of those can even really just have to do with thoughts. So I think, someone asked a question, how can you play a role in supporting someone that has OCD, maybe helping them recognize it and maybe encouraging them to go ahead and get help for that. So I think the treatment is pretty, is similar, but it might help to have kind of that religious support as well.
Yeah, and I'm seeing, or I get a lot of emails from around the world where people are struggling with religious OCD. And I want to say this isn't just affecting Muslims. This affects every religion. There are a lot of people that struggle because in every religion, cleanliness is next to godliness, right? And if you already have OCD, it can easily transfer and morph into religious OCD where you overdo it with the cleaning, overdo it with the prayers, overdo it with the guilt and the shame. Mm-hmm. And so supporting somebody is another challenge that a lot of people are having because there are people that are really, really struggling. I had a relative that during a stressful period became really, really scrupulous about her prayers. And it would take her a long time to just clean herself and get prepared for prayer. And it took her just a lot of calming and support for her and showing her the strategies and the resources for her to manage her anxiety. And for a brief period, she did need to take some medication in order to be able to calm her system down. So I think that is an issue that people have with people, family members that struggle with the scrupulosity, and then how do they help them? Did you want to add to that?
No, that's really interesting. No, I mean, yeah, I don't think there's anything else to add. It's really fascinating. So, but it's kind of, and that's the thing with OCD, sometimes you can have like the behavioral component, but there can definitely be obsessions too. So, again, I was reading about kind of confession. And again, like any kind of negative thoughts, feeling like you need to confess all of that. And it's interesting because it can be kind of hard to differentiate when does it get like kind of too extreme. I mean, like all of our religions kind of have a certain way of doing things. And if you get really obsessive about it, is it just the person being like very pious, or, is it kind of like they're more religious, or when does it, it's kind of a fine line maybe for some people, or when does it kind of definitely over the top too much?
And it's kind of a hard thing when it comes to religion and God, because like if you're afraid of snakes, you can do the exposure treatment. But if you're like afraid of even prayer, if you're even afraid of your thoughts and you're constantly focusing on the devil, putting somebody in that exposure response treatment is really difficult, or telling them not to pray for a while. It's very difficult because it really triggers a lot for people. And then there are people, like somebody mentioned, these thoughts are judged by God, and you're feeling like you're being blasphemous by having some of these negative thoughts or sexual thoughts. And so I think that's the scrupulosity is very more difficult than dealing with just regular OCD. Because it is dealing with the unknown. I mean, I can't just say, well, God doesn't care about that. I mean, I can tell them that, or I can have a belief that God is loving and merciful and isn't focused on the little thoughts that we have, or the negative thoughts that we have. But other people might not agree with that. They might be very well like, no, I believe in a very fearful God, and that I'm going to be judged and I'm going to be punished. And I think that's another thing, a discussion I want to have with the religious leaders. And I don't know if you and I can do this topic much more justice.
Yeah, that's really where the intersection of spirituality and religion and psychology is. These are really important. That's a very important topic, and you bring up a lot of good points.
Please be sure to watch part 2 of this interview with Dr. Maroof, where we'll be discussing self-medicating with marijuana, dealing with eating disorders, involuntary hospitalizations, and so much more.